about, I'm very happy to be here to talk to you about the ministry that I have, a mental health ministry. And some of the lessons that I learned that I put in the book that I was published by Skinner House in 2020, Health, Showing Up for Each Other's Mental Health. So I'll start with a story. A woman who was a UU told me that she and her husband had been visiting their daughter who was in a psychiatric ward having a very hard time. And they would go there every evening, rush there after work, both of them had jobs, to spend time with her. And at one point, they got a phone call from someone in the church saying that another church member was hospitalized, and they were trying to put together some meals to take to the family. And could they possibly provide a meal and bring it over to that family that was preoccupied with their loved one's illness? They wanted to help, so they put together a meal, and they rushed over to the other person's house and gave it to them. And then they went off and to visit their own daughter who was hospitalized. And the woman told me that on the way home, she thought, wait a minute, we have someone that's hospitalized. Nobody's bringing us casseroles. Is there a double standard here? And the answer is yes, there is a double standard. People who are in the psychiatric ward, and I dare say the people that are on hospitalized for other things that like getting over a addiction, don't receive casseroles on a basis. And my message to you, the short message of this sermon is this no casserole disease needs to stop. And just a few facts here. 1 in 5 American adults each year is diagnosed with some sort of mental health condition. Nearly half of these coexist with addiction. And it's been worse since the pandemic. I've heard now that it's 1 in 4. That's a lot of people. So you can be sure that the pews or your Zoom screens every Sunday are filled with people that are living with mental health problems and their loved ones. And many of them are suffering in silence because they feel like it is not something that they can share. So just a couple of definitions of terms here. Mental health, this is from the American Psychiatric Association, the successful performance of mental function resulting in productive activities, fulfilling relationships with other people, and the ability to adapt to change and cope with adversity. So it's productive activities, relationships, and being able to cope with change. Those things characterize mental health. A mental disorder, on the other hand, is a behavioral syndrome that means a collection of symptoms creating impairment or distress in thinking, mood, or behavior that has been diagnosed by a mental health professional. So it's thinking, mood, or behavior. And another important thing to understand is that mental health is a continuum. It isn't like all people are either mentally healthy or mentally disordered. We all exist somewhere on the continuum between some kind of mental distress and non-distress. And some people are more at one extreme than the other. But it's a continuum that we all live on. And what does it mean to recover from mental health problem? Mental health recovery is a process of change in which people improve their mental health and wellness. They live a self-directed life. and they strive to live to their full potential. Notice that this is not necessarily the absence of symptoms or the absence of the need for medications. So this is a definition from the Substance Abuse and Mental Health Services Agency of the US. So it's recovery is a process, and it doesn't mean that there aren't any symptoms or that you're off medications. It's a process to live a self-directed life and to the potential that you're capable of doing. So I'll tell you a story from my own life. This is a picture of me and my then 10-day-old daughter, Carol. Shortly after that picture was taken, this is 1978, so you know how long ago that was, I had a very serious postpartum depression, and I was hospitalized in the local psychiatric ward. This was a shattering experience for me. I felt like I was a damaged human being. I was one of the lucky ones that was able to get better or to get back to a functioning self anyway in a fairly short amount of time. But I still felt like I was a damaged human being, and I was sorry that I had had that experience and didn't want to ever have an experience like that again. This feeling of, self hate, I guess, or not liking myself because I had had that experience, that lasted literally for 8 years. And I finally said to myself, I don't want to live my life like this anymore. And I went back to my psychiatrist, same guy who would take care of me in the hospital. And I told him that I was willing to change anything in my life so that I wouldn't be so miserable all the time. And so we entered into this fairly intense period of exploration. He gave me assignments and wouldn't let me duck them when I tried to. And I kept saying, that I was going to do what he was going to let me do, because I really wanted to be different and I wanted not to be so miserable. And at one point he said to me, "What are you doing for yourself spiritually?" And I said, "Nothing," because at that time I was not going to church and I hadn't been for many years. And he asked me, "Would you like to learn how to meditate?" And when he said that to me, I thought, what? You've got to be kidding me. How did just sitting around and doing nothing, how is that going to solve anything? But I had promised myself that I would try whatever he said. And he gave me a little book on meditation. And I went home and I would sit sometimes quietly for 5 minutes, 10 minutes, something like that. And after about a couple of weeks, when I went back to see him, I said, "I don't know where it came from, but I'm happy." And I'll never forget what he said to me. He pointed at me and he said, "It came from you." And that was a moment, sort of head-turning moment in my life when I realized he was right, that happiness came from within. And that is what I needed to be paying attention to, and not what other people thought or anything like that, but it from within. And it resulted in this sort of spiritual experience and what I consider to be a rebirth of myself. I don't think rebirth is too strong a word. And eventually it led to finding a different purpose and a different career in my life. I had been working full-time as a software engineer at IBM, and I decided to change my career. And I eventually, well, first it wasn't right away, but over time, I got engaged with a congregation. I started sharing my story. I started a depression support group at the congregation, and eventually I decided this is what I want to do with my life, and never looked back. And I'm very pleased with what I've done, and how I am using my own story to help other people, to, not because it's so unique, but because it can help other people to acknowledge that they have had difficulties, and it is possible to recover. So how do people recover? There's a lot of aspects to recover. It isn't just take these pills and you'll be okay. Pills, yes, are important, but there are many dimensions to people's lives. There's a spiritual dimension, as I discovered. There's an intellectual dimension, learning things, physical dimension, getting enough exercise, environmental dimension, where you're living, where you're spending your time, how are you being out in nature, financial dimension, do people have enough to be able to provide themselves with the things they need, an occupational dimension, are people doing something with their lives that they think is important, a social dimension, relationships with other people, and an emotional dimension, keeping track of one's emotions. So my message to you is that, yes, the doctors can help with the pills that are important, at least that some people find important, but members of congregation can help in many of these other aspects. You have certainly spiritual services on Sunday, intellectual discussion groups or learning groups, physically, encouraging people to get exercise, helping people to find a place in life where they think they're important, socially, providing relationships with people. All of these things make a whole person, and that's what it really takes to recover. So a mental health crisis is a spiritual problem as well as a psychiatric one. A person might experience existential doubts about their selfhood, about what is truthful, what is meaning, what is love, what is agency in their lives. And it may even undermine their faith in something divine or their belief in justice. I have a list here of founders of religions and their followers that have had spiritual awakenings. Some of them that don't look all that different from some of the people that I met in the psychiatric ward. So spiritual practice is helpful to many with mental health problems. In fact, there's a study that showed that spiritual practice is the #1 coping skill that people have. They pray, they meditate. If you ask, what is it that you do that's helpful? Many times that's what people will say. Here's some examples of the kind of spiritual practice: meditation, prayer, music, spiritual direction, Tai Chi, Qigong, or yoga, chanting. There's many other as well spiritual practices, but many people find that this is the #1 coping skill that they have. So I want to talk about how does one recover? And the first step to recovery is hope. We may need to hold hope for somebody else if they don't see it. I'll tell you a story about when I was first in the psychiatric ward. I had I was suicidal, and that's why I was hospitalized, and very unhappy being in the psychiatric ward. The doctor said maybe he could help me, and I thought, he just tells that to everyone. And my family said that they were hoping for my recovery, and I thought, I'm just a burden to them. And I think it was the second day that I was there, or something like that. Another patient came over to see me and sat down next to me and said, I came into the hospital 3 weeks ago, and I was so disturbed and had no hope. And I worked with the doctors and I feel so much better now, and I'm just about ready to go home. And if I got better, I know you can get better too. And when she told me that, I thought, maybe there's hope for me. Maybe there's hope for me. And that was really the start of my recovery. So sometimes we have to hold it for other people. Another thing that's very important is presence, just basic human presence, and what we call active listening, listening without judgment. So even if somebody's saying something that you don't agree with, don't judge them. You just listen. You validate their feelings, how they must feel. You don't give them advice. Your human presence is a sacred gift. I'll tell you a story from when I was an intern minister. One Sunday morning, everyone was bustling around, getting ready for worship, and a woman came up to me who I knew was really struggling with anxiety issues. And she said, Barbara, I'm so anxious. I don't know what to do. Please help me. Help me. I'm so anxious. And I thought, what can I do? And I thought, okay, why don't you and I go into the library? I knew there was no one in the library at that point. And why don't you and I go in there and we can sit? And I sat down in the library, closed the door, sat there holding her hand. And I was thinking, what can I tell her? What can I possibly tell her to do? So no words were spoken. I was just sitting there with her, holding her hand. And after a couple of minutes, she said to me, I feel so much better just being here with you. Wow, what a lesson for me. My presence, not what I was saying, not any great ideas that I was going to give her, not any, program that I was going to send her to. That wasn't what was important, was my presence. And I submit to you that we all have that to give to people. We all have our human presence to give to people. I have learned this lesson several times in my ministry with people, with just realizing that it was just me, my presence that was necessary. And I submit that each of you have a sacred presence as well. So creating a safer space, ending whatever silence or secrecy or shame is around, ending negative comments. I know there are people that have told me that they have heard many, even in UU coffee hours, have heard many derogatory things about people that are in psych wards or whatever. That needs to stop. It's not helpful to people, and knowing that there's so many people that are affected, you don't know who it is that you're talking to, what might have happened to them or their family, so just not good to make derogatory or joking comments about things like that. Another thing that I have found that is really helpful is what I call public witness. When I have given my story in congregations and talked about what I've been through, I do that not because my story is so incredibly special, but because I know that helps people. It makes it safe for people to admit to themselves that they have a difficulty or a loved one has a difficulty. And at the end of the service, that I'll say, please stand as an act of public witness if you or someone you love has lived with a mental health problem, or stand in body or spirit if you or a loved one has lived with a mental health problem. And every time I've done this, which has been dozens of times, 80 to 100% of the people will stand up. And when I've done it online like this, and I ask people to write in the chat I'll try this later with you. There's a lot of people will say, yes, 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 that's I've done. And when people look around and realize how many people are affected, so almost everyone is affected in some way or another, then it's okay to talk about it. You can talk about the problems that you've been through or that your loved one has been through. And it's the level of stigma goes way down. And I would say the casserole disease goes way down as well. And talk about suicide because it's something that's deeply troubling to family, friends, and fellow congregants when it happens. Someone who is suicidal needs professional mental health care. I needed it when I was suicidal. What the congregation's role is authenticity, you know, being who you are, giving people hope, giving them empathy and compassion for what they've been through. And a lot of times people will say, you know, when they've gone through a suicidal problem, that just being able to talk to someone was really helpful. So what is it that helps a person when they have mental health difficulty? So these are sort of categories. There's a lot of things underneath these, but they're categories of things that I have heard from people who has helped them. You know, during my ministry, I've asked them what helps them, and these are the kinds of things that help. Getting professional help or peer help. Some people are greatly helped by professionals. Some people are not. In fact, some people think they have been damaged by professionals, and a much better way for them to get help is from peers, or even a combination of professionals and peers. Taking care of your body, getting enough to eat, getting enough to drink, getting enough sleep. Those things are really important. Helping to manage your stress. Know what it feels like when you're in stress, and know what kinds of things help you to manage it. Being aware of your emotions, you know, knowing if you have a mental health problem that sometimes waxes and wanes, know how to recognize what the part of the cycle that you're in and what it is that helps you when that happens. Enriching your life in some way, learning how to create something or learn something new, read something, engage in artistic practices. And for me, it was weaving. I became a weaver, and that has enriched my life. And then engage with your spirituality, as I was saying, that's very important. Let's see, I think I skipped a chart here. What helps the family and loved ones? Again, professional and peer help. The most widely known peer organization for families is the National Alliance on Mental Illness, NAMI, N-A-M-I, and they have a program called Family to Family, which families teach other families about what it is that helps them and their loved ones. Learning how to communicate effectively with people, and how not to make it blow up, but how to de-escalate things. Helping your loved one live with their situation as much as possible. And finally, don't let it take over your life. You know, have a life of your own. So mental health is a social justice issue, as well as a medical or psychiatric issue. It is hard for many people to get mental health care. Insurance issues, money issues, sometimes there's non-existent coverage or it's inadequate. Many practitioners these days don't take it, and the cost of good mental health care is prohibitively high. So that money issues our big one in terms of making it hard to get mental health care. And also the lack of a wide availability of mental health treatment. Sometimes if you talk to your insurance company, they give you a list of here's the practitioners, and you go through all of them and they're all full and not accepting new patients. Many times you get short-term interns when you can get sliding scale, and so you don't get a long, even though they can be extremely helpful, of course, you don't get the long-term care for people. And many alternative therapies are costly when they're available and not available widely. There's also cultural, linguistic, and geographic issues. So, many people who are LGBT find it difficult to find practitioners that are friendly to that lifestyle. If people don't speak English, at least in the US, it's very difficult. And then many places are geographically isolated and they don't have therapists in those areas. Another huge one is involvement in the criminal justice system. Jails and prisons are full of people with mental health problems. My own community is 40% of the people in the local jail are taking mental health pills every day. 40%. I mean, they're not. That is not the best place to get well. And then there's a slogan: "Don't get well in a cell." I know a lot of people that are protesting. They say that. And engagement with the police. Many people say that by a police officer when they for everyone. It's tragic for the police as well as for the person. And sadly, often the most troubled people get the worst care. And it's really, the mental health situation in this country is really at a crisis point. So, yeah, I think I skipped a chart here. Let's see. All is not lost. There are many fine peer and self-help groups that are free. The place where I work is a self-help organization, a peer support group, and it's provided, so we get a funding from the county that's provided for clients for free. Some local governments have social services that are free on sliding scale. There's ways to get support online. And many of those suggestions that I had in the list of what helps the individual don't have a cost affected. So that, you know, all is not completely lost. So if you want to work on social justice, on mental health issues, there's a whole list of here of things that one might concentrate your activities on. And, you know, I try to keep my toe in a lot of this. Right now, I'm in working with a group planning a protest outside of our county office because of the poor treatment that people are getting in our local jails. So a lot of things to do. If you want to contact me, that's my contact information. And I'm going to end this with a call for public witness. I invite you to write in the chat if you have you or a loved one of yours has lived with a mental health problem, to write yes in the chat, and if you have not, to write no as a way of public witness. Thank you. You will know the truth, and the truth will set you free. Amen.